Good evening to all. Thank you for the organizers and Dr. Nadesh Babu sir for this wonderful meeting. Dr. Nadesh Babu sir called me and told me, Madam, you have to talk about vaginal rejuvenation needs, best wants. The thing came in my mind was, what is the difference between vaginal rejuvenation and the vaginal cosmetic surgery? I will come to that point. What are the benefits of vaginal rejuvenation? It improves the tightness of vagina, it increases lubrication and moisture, it increases the vaginal sensitivity and sensations, and strengthens the weak vaginal and pelvic floor muscles. It also improves the painful intercourse, helps somewhat for urinary to control the urinary incontinence, and also enhance the appearance of vulval area. It also importantly boosts the self-confidence and self-esteem. What is the difference between cosmetic vaginal surgery and the surgery for vaginal rejuvenation? Cosmetic vaginal surgery. This surgery we are doing the structures to modify the structures around the vagina. It is the term that covers various procedures that aim to change the appearance of female genitalia such as labia, clitoris, vagina and hymen. But these procedures are not intended to produce or enhance the orgasms. Coming to surgeries done for vaginal rejuvenation, these procedures that intended to produce or enhance the orgasms. Under cosmetic vaginal surgery, the following surgeries are come under that topic. That is monsplasty, that is mons pubis reduction, and labia majora reduction, labia majora augmentation, labiaplasty, hymenoplasty, and vulval skin lightening treatment. These are all comes under cosmetic vaginal surgery. The topics under vaginal rejuvenation are vaginoplasty for congenital absence of vagina, surgical vaginal tightening, laser vaginal tightening, clitoral wound reduction, and G-spot amplification and PRP injection for vaginal dryness. I'm going to discuss about these topics. Coming to monsplasty, this surgery removes excess skin and fat from the mons pubis, the fat pad above the pubic bone. It can improve the appearance and function of pubic area by reducing the bulging, sagging and discomfort in the pubic area, in the mons area. It can also enhance the self-confidence and sexual satisfaction. In monsplasty, usually we do first liposuction to reduce the fat in the pubic area, followed by we will remove the excess skin in the mons pubis. The scar will come under the upper part of the mons pubis in the cesarean section area. It hides inside the bikini area. It will not be visible at all after wearing the bikini. Usually we are doing this monsplasty as it's monsplasty alone or along with the abdominoplasty or as a part of circumferential body lift. In case of abdominoplasty, this lady is having a overhanging abdomen along with hanging mons. After surgery, see how much lift she is having, she will get after the surgery. This is the pre-operative and post-operative picture. Along with abdominoplasty, she got a good mons lift. Nowadays, lot of bariatric surgeries are more common. Followed by bariatric surgery, women are developing circumferential loose skin in their body. So we are doing circumferential body lift for those women. See how nicely this patient got mons lift after circumferential body lift. The next topic is labia majora reduction. This surgery is aimed to reduce the size or improve the shape of the labia majora, that is the outer lip of vulva. Women choose this surgery for aesthetic reasons, such as to make the genitalia look more symmetrical and youthful. For functional reasons also, such as to reduce the discomfort or irritation caused by the large and sagging labia majora. In this surgery, we remove the excess skin and fat from the inner side of the labia majora and suturing the wound with resolvable stitches. The scar is usually hidden along the natural crease of the labia majora. This is the picture representing the labia majora reduction. Usually here also we used to do liposuction followed by removing the excess skin. The labia majora reduction surgery is usually permanent unless there are changes due to aging, weight loss, weight fluctuations or pregnancy. Most of the women report high satisfaction rates and improved self-confidence and sexual well-being after the surgery. The labia majora, the next topic is labia majora augmentation. That is, increase the size of labia majora. The aim is to increase the fullness in the labia majora, that is the outer lip of vulva. Women choose this surgery to correct the saggy or deflated labia majora due to aging, weight loss or childbirth. It can also improve the appearance and function of the pubic area and enhance the self-confidence and sexual satisfaction. Usually in two ways we are doing labia majora augmentation. One is common procedure is fat grafting. In this technique, it takes small amount of fat from another body area, either abdomen or thigh. Then we process the fat and we inject it to the labia majora. This can provide a natural looking and long lasting result, but it may require more than one session to achieve the desired volume. Another one is filler injection. Injecting synthetic filler made up of hyaluronic acid is a common procedure. This can provide an immediate and noticeable result, but it may require repeat injection. Every 6 to 12 months we have to repeat it to maintain the effect. The next topic is labiaplasty. This is a type of cosmetic surgery that involves changing the size and shape of the labia, the folds of skin around the vaginal opening. What is the benefits of labiaplasty? It reduces the physical discomfort or irritation caused by large, uneven or protruding labia that can interfere with activities such as exercise, sex or wearing certain clothes. The women also want the surgery to improve the appearance or symmetry of the labia for cosmetic and also for personal reasons. Okay, what is the ideal aesthetic labia minora? That is, small labia minora, not protruding beyond the labia majora, is an ideal aesthetic one. It is also a desired goal for most patients. That is, they are calling this as barbecue type. There are two classifications to classify the labiaplasty. One is Markov classification. This is the degree of protrusion of labia minora past the labia majora. Depends upon the length of labia minora past the labia majora. This classification, class 1, class 2, class 3, they classify this one. And another one is Vaginal classification. This is based on the morphology and anatomical type. Sometimes this labial hypertrophy involves upper 1/3, sometimes middle 1/3, sometimes lower 1/3. There are a lot of types of corrections are there. Carpillary linear excision technique with resection, deepithelialization, like that. I usually perform curved linear excision technique. This is one of my case with the labial hypertrophy. This is a 16-year-old girl. I am measuring the labial hypertrophy length. This comes under Markov classification 3. The previous marking was done for the excision. After excision of the excess labia minora, the raw area was sutured after finishing the surgery. This is the appearance after 15 days. This is another one case. This is the different type. This right side involving the upper 1/3, left side is involving the middle 1/3 of labia. This immediately after surgery. This is the follow-up picture. Coming to hymenoplasty, this is a more secretive and least studied aesthetic female genital surgery procedure. The information about the procedure tend to be based on anecdotal reports only. Coming to functions of hymen, the function of hymen is very unknown. It has been proposed as the vaginal barrier against external source of infection before puberty. Coming to indications, there is no valid scientific indication for hymenoplasty. It is mainly performed primarily for cultural reasons. It saves the women from social embarrassment and gives them a chance to enjoy the confirmation of being a virgin all over again. These patients definitely need a preoperative counseling because repair has no direct medical benefit. Absence of hymen or failure to bleed is not necessarily a sign of a previous intercourse. Less than half of the women in the retrospective study stated they had not bleed with initial sexual penetration. These things we need to inform the patient and make them understand. Coming to timing of surgery, not sooner than 14 days before wedding to prevent the bleeding during intercourse, and not much later to prevent the visibility of suture remnants. Lot of techniques are available. I am using suturing technique, suturing only technique. This is one of my patient, before and after picture. I did surgery with suture only technique after leaving a small hole to escape of menstrual fluid. This is another one patient. The next topic is vulval skin lightening treatment. There are two types of treatment available for vulval skin lightening, that is laser treatment and chemical peeling. Laser treatment, there are CO2 lasers available, carbon peel lasers are available to lighten the skin in around the vulva, and also chemical peel, lot of chemical peelings also available. But these are all, it takes multiple sessions, it needs multiple sessions to lighten the skin, either 5 or more, in 21 days interval. Then I finished the cosmetic plastic surgeries. Now I am coming to vaginal rejuvenation. These are, as I already told, these procedures are intended to produce or enhance the orgasms. These are all the surgeries come under vaginal rejuvenation. First I am coming to vaginoplasty for congenital absence of vagina. This is a rare condition that occurs when the vagina does not develop properly before birth. We all know this is also known as Mullerian agenesis. It affects in 1 in 15,000 of females at birth. People with this condition usually have normal external genitalia, but they may have a shortened or absent vagina and cervix, and no uterus or partially developed one. This is one of my patients with the absence of vagina, cervix, uterus, ovary, with mild pimple in the area of vagina. Previously, they are doing vaginal reconstruction by Vaginal procedure, that is creating a pouch in the vagina. After that, they put a graft, with fixing the graft with a mold like that. Otherwise, a lot of lax options available around the vagina. They will produce a lot of scars around the vagina. But now, the innovative technique by Dr. Purushothaman, by horseshoe flap vagina. It's a new technique of vaginal reconstruction with labia minora flaps for primary vaginal agenesis. In this technique, we are taking flaps from the labia minora with intact blood supply and nerve supply. We create a pouch-like thing and we create a pouch using the flaps. After creating a pouch in the empty pouch in the vagina, we fix the flap inside the empty pouch. That is, this is the marking for horseshoe flap. That is, we are taking a flap around the labia minora. That is under hairy skin of labia minora. The flap was elevated with intact blood supply and nerve supply. The raw area was closed. The flap was made into a pouch. Then after it inserted into the vaginal area, after creating an empty pouch in the vagina and fixed into the top of that vaginal pouch. After the surgery, see how much the length of the dilator entered into the created pouch. This is a simple and single stage procedure, easily reproducible. Flap has a predictable vascular supply. Reconstructed vagina is sensate, that is more important. Procedure is less morbid, no scars around the vagina or thigh like that. Near normal appearance is achieved. The cavity direction is also postero-superior as normal female. Dimension is adequate. No hair in the reconstructed vagina, no foul-smelling discharge, no evidence of contraction. Because it's a retractile skin, we are taking around the labia, taking in the area of labia minora. The next procedure is vaginal tightening. This surgery aims to restore or enhance the tightness and sensation of vagina. This is to improve the sexual function. This also to improve the appearance of symmetry of the vaginal opening and surrounding tissue. It also somehow improves the urinary incontinence. This is one of my case with 3 normal deliveries. After that, she came to me for vaginal tightening procedure. The U flap for vaginal tightening was marked, and the flap was elevated in the skin, and the flap was extended into the floor of the vagina as diamond shape. After excising the flap, the raw area was closed. The bulbocavernous muscle and the transverse peroneus muscle was sutured to tighten the vagina. This is the after picture. Post-operative care, no need for any dressing inside the vagina. Prescribe laxatives to avoid strain. Avoid excessive physical exercise during the first week of surgery, and also avoid sexual intercourse in the first 2 months after surgery. Next one is laser vaginal tightening. We all know about this. It treats the loose vagina. It also treats the loose labia. For dry, it helps, somehow helps in the dry vagina also. Also first and second degree leaky bladder also improve with this laser treatment. Advantage is no pain, works in outside the labia and inside vagina, no downtime, suitable for all ages, lasts for 1 year. Next procedure is clitoral hood reduction. This is a sensitive, we all know that clitoris is a sensitive part of female genitalia that plays a key role in sexual pleasure. This procedure aims to remove the excess skin from the folds that cover and protect the clitoris. This is the picture before and after picture of clitoral hood reduction. This surgery involves making small incision on sides or along the length of the clitoral hood and removing the excess tissue. The surgeon will try to preserve the natural shape and function of the clitoris to avoid damaging the nerves or blood vessels. Another procedure is G-spot amplification and PRP injection. We all know we are doing lot of procedures using PRP. And I will come to the topic name, vaginal rejuvenation needs best ones. In this procedure, what are all the needed procedure, what are all the wanted procedure? In 2010, Goodman et al. Reported on the large multi-center study, he concluded that many women choose to modify their vulvas and vaginas even though they has been informed that these female genital plastic procedures were not performed to correct the abnormalities, yet they had an excellent outcome in both general and sexual satisfaction. So to conclude, both vaginal rejuvenation and vaginal cosmetic surgeries help to improve the sexual satisfaction of women. So all these procedures are needed for every woman who wish to improve their sexual life. Thank you all.
Thank you. Are there any comments from the floor? Any questions?
We are the experts in the
Expense of
Sir,
PRP.
It's very easy to prepare expense.
Cost.
Yes. It's different from place to place, sir. We are starting expansion. Platelet-rich plasma therapy. Platelet-rich plasma therapy. We are preparing platelets-rich fluid from the blood.
So before we conclude this comment,
insurance coverage for this kind of surgeries are very
Sir, congenital absence of vagina we can claim. Otherwise, all other surgeries are purely comes under cosmetic surgery.
so another expanding role of vaginoplasty is in the transgender population, where the scrotum skin is used, and that I think is the same as what you're using with labia minora.
Yes.
And I think I wanted to leave with this last comment on vaginal rejuvenation lasers. I think they are hyped. I think there are no randomized controlled trials to say that they actually help. It is more of a commercial gimmick.
Definitely.
So I think I would urge the audience here to please make sure that you're not encouraging women to spend money on these kind of procedures.
Surgical tightening is the best thing and long lasting.
And for urine leakages,
Also,
PRP is much better than doing lasers.
Thank you.
One thing for both of you. There is a thing called as Himsala chair.
Yes.
Himsala chair. It's upcoming trend. And
Yes.
shockwave
So-
therapy for female issues.
So
is
that
one of that.
actually is a substitute of doing Kegel's exercises. And I think it is better that we as gynecologists teach all our patients of all age groups to do Kegel's exercises rather than sitting on the expensive chair. But we are using it for a lot of postpartum women to regain muscular tone. And I think what we have lacked to do as a prevention is to teach them the Kegel's exercises. So this commercial company has come up with this very expensive chair, charges a lot of money for half an hour sit or a 20-minute sit on the chair. Can be done very simply at home. Our yoga asanas, like the Mool Bandh, is a very, very good way of encouraging pelvic floor tone and contraction.